Hello, I am Lion Dr. Rana Sanjay Pratap Singh, alias Dr. Rana SP Singh, uh, Diabetes Chairperson, Lions Club, Patliputra, Astha. Today topic discuss diabetes, how control and different type diabetes. Understood, understanding diabetes types, cause and how to manage it. Diabetes is one of the most prevalent chronic health condition worldwide, affecting millions of people. It causes when the body cannot regulate blood sugar level properly. Glucose is essential as it provides energy to cell, but an imbalance in glucose level can lead to various health complications. Health advisory and what diabetes? Diabetes is a metabolic disorder characterized by high blood sugar level over the prolonged period. Blood sugar or glucose is vital as it fuels the cell of the body. Insulin is hormone produced by the pancreas, help regulate blood sugar by facilitating it enter into cell. However, in individuals with the diabetes, the system's malfunction leading the high blood sugar levels, if left unmanaged, diabetes can lead to severe complication and affecting the eyes, kidney, nerve, and heart. Cause of diabetes. The cause of diabetes very vast. These types have a common factor including genetics, lifestyle, environmental factor. Here, closer look at some primary causes. First, insulin resistance. In type 2 diabetes, the blood develop resistance to insulin, causing glucose are build up in the bloodstream. Second, autoimmune disorder. Destruction in type 1 diabetes, the immune system mistakenly attack insulin producing beta cell in pancreas. Third, genetics. A family history of diabetes increase the likelihood of the developing the condition. Fourth, lifestyle factor, obesity, lack of physical activity, and poor diet contribute significant to type 2 diabetes. 5. Hormonal change. During pregnancy, certain hormones can make cell less responsive to insulin, leading the gestational diabetes. Type of diabetes. There are the several types of diabetes is the unique characterize and cause the three primary types. First, type 1 diabetes. Type 1 diabetes, also known as insulin dependent diabetes or juvenile diabetes, is an autoimmune condition. It occurs when the immune system attack the destroy insulin producing a beta cell in pancreas. As a result, the body produces little to or no insulin. The types typically develops in childhood to adolescence and thought it can be occurs in adult. Symptoms of type 1 diabetes: frequently urination, explanation, weight loss, increased thirst and hunger, fatigue, blurred vision. People with type 1 diabetes is required for lifelong insulin therapy as their body cannot be produced insulin. Second, type 2 diabetes. Type 2 diabetes is the most common form according to around 90 to 95% of all diabetes cases. It is usually occur in adult, but it is becoming increasingly common in children and adolescents due to rising obesity rates. In type 2 diabetes, the body because resistance to insulin or the pancreas fail to produce enough insulin leading to high blood sugar level. Risk factor for type 2 diabetes: obesity and overweight, physical activity, poor dietary habit, age, family history of diabetes, ethnic background, certain groups such as other country, African, happening South Asia. Symptoms of type 2 diabetes: slow healing wound, darkness skin, certain areas, increased thirst and hunger, frequently infection, fatigue, management of 2 diabetes over involving lifestyle change such as diet and exercise along with the oral medication and sometimes insulin therapy. Third, gestational diabetes. Gestational diabetes occur during pregnancy and typical is after childbirth. However, it increases the mother risk of developing type 2 diabetes later in life. Gestational diabetes can also increase the risk of complication during pregnancy and delivery. Risk factor of gestational diabetes: family history of diabetes, obesity, older maternal age, previous gestational diabetes in prior pregnancy. Women with gestational diabetes required close monitoring and is some insulin therapy to manage blood sugar levels and reduce risk to both mother and baby. Other type of diabetes, in addition to three primary types, there are other less common type of diabetes, including maturity onset diabetes of the young body, a rare genetics form usually developed in teenager or adult. Then second, neonatal diabetes, a form of diabetes that appears in the first 6 months of life. And then secondary diabetes they arise due to other conditions such as the pancreatic disease or as a side effect of certain medication. How to manage diabetes? Managing diabetes effectively required a combination of lifestyle change, medication, regular monitoring, and support. Here are some essential strategies. First, adopt balanced diet. And a healthy diet is circulating is managing diabetes. Focus on consuming whole grain, brown rice, quinoa, oats, whole grain, wheat bread, and provide sustained energy and help control blood sugar level. Fruits, vegetables, lean protein, healthy fats, olive oil, nuts, seeds, avocado, and beneficial in moderation. Avoid food high sugar, saturated fat, and refined carbohydrate as they are the cause blood sugar. And then second, regular physical activity, exercise, one of the most effective way to control diabetes. The help your body use insulin very capacity and lower glucose level, and for at least 50 minutes of moderate intense exercise like walking, swimming, or cycling per week. Strength training for also benefit by increasing muscle mass, which help improve insulin sensitivity. Third, medication and insulin therapy. People with type 1 diabetes require insulin therapy for life. For type 2 diabetes, an oral medication or insulin therapy may be prescribed if lifestyle changes are not sufficient. Common medication including metformin, Impa, sulfonylurea, GLP-1, DPP-4, and always consult healthcare provider before starting or changing medication. For regular monitoring or blood sugar, frequently blood sugar monitoring is essential to ensure that the glucose level remains with the target range. Home glucose monitoring allows people with the diabetes to check their blood sugar levels regularly. Continuously blood glucose monitoring or real-time data are particularly useful for those need close monitoring, such as people with type 1 diabetes. Maintain healthy weight. Being overweight or obese increase the risk of type 2 diabetes. Diabetes makes it harder to manage the condition. And 6, stress management. Chronic stress can affect blood sugar level by triggering the release the hormones that increase glucose. Techniques such as the mindfulness, meditation, yoga, and deep breathing exercise can help reduce stress and improve overall well-being. 7th, routine checkup. Regular visit to healthcare provider can help monitor blood sugar and early and HbA1c measure or average blood sugar over the past 2-3 months. Eye examination, nerve, and kidney function test monitor kidney health. Complication of controlled diabetes. Uncontrolled diabetes can lead to severe complications including cardiovascular disease, high blood sugar damage, blood vessels, increasing the risk of heart attack and a stroke. Kidney damage, nephropathy, diabetes is leading cause of the kidney failure. Nerve damage, neuropathy, high glucose level can damage nerve, particularly in the legs and feet. Eye damage, retinopathy, diabetic retinopathy can lead to the blindness if not management. Food damage, reduced blood flow, and nerve damage increase the risk and food ulcer the infection. Thank you.